I wanted to join the NHS because I want to work in healthcare.
I wanted to join the NHS because I was always interested in science from a young age.
I have my mother and auntie who work in the NHS, so I was really open-minded to wanting to try and work for the NHS as well.
So I wanted to join the NHS because I wanted to make a real difference to the community and also gain some medical experience.
So for me, I always knew I wanted to go into healthcare, and in particular I wanted to work in the NHS to help people.
This program that the apprentices ran along with the NHS was a great way for me to get that foot in the door to actually work in healthcare.
So I'm actually a HEA and I work at the Macmillan Brook unit. I weigh and height patients that come in.
In a typical day working for the NHS as a healthcare assistant, I would be placed in a ward looking after patients, and we would have between 6 to 8 patients to look after.
So on a day-to-day, I'm monitoring the patient's health condition. I deal with also the personal care side as well.
On a day-to-day basis, as a pharmacist, I go to the ward, I see the patients, I take their medication history from them once they're admitted into hospital. I will help with the dispensing and the checking process before handing it out to the patient and counselling them on how to use this medication.
I also help doctors and nurses prep their notes, so they see what clients they have, their medical history, and just make sure that everything's on top.
The most rewarding aspect of my job is just to help patients and making them comfortable.
The most rewarding thing for me personally is helping people.
The most rewarding thing about my job is not only the feedback from the patients themselves, but also through my team members as well.
It could be as simple as making sure they're comfortable in bed, helping to feed patients, even fetching coffee and tea for patients, and making sure that they have a good patient experience.
I am potentially saving lives by checking that the medications are safe for the patient, and I'm making a difference into their care.
The most rewarding thing that I have seen is when that chemotherapy bell goes off. It's a really, really nice feeling. You see a patient come in several times for treatment, then once that bell goes off, it just means some amazing, great news for that patient. So that was really, really, really rewarding to see.